Hi everyone, I'm Dr. Stephen Davidson, the sexual integrity coach and the author of Sexual Integrity, Finding the Courage to Be Yourself. If you like this video today, I hope you will subscribe or hit the like button, maybe even forward the video to a friend. And I would also love to hear from you. It's my intention to provide you with science-based sexuality education. So if there are subjects that you want me to address pertaining to sexuality or relationships, please let me know. Today I'm going to talk about erectile dysfunction, commonly referred to as ED. It's more common than you might think, and it's an issue that brings men and their partners to sex therapy. ED is a source of distress for everyone who's involved, especially the man who has ED. There are various causes for ED, and it's suspected that every man will deal with ED at some point in his lifetime. Most men think that ED is a medical problem only. So they run to their doctor or they sign up for one of the online pharmacy programs that will give them ED medication. And sometimes the prescription works, but sometimes it doesn't. Since ED can also result from relational or psychological problems, the pill isn't always effective. Men today are under a lot of stress when it comes to sex. Men have always been expected to initiate and be actively engaged in sex with their partner. For straight couples, historically, men have been in charge of when sex happened and how frequently. And historically, women were expected to just simply show up and put out. But today, women are less passive when it comes to sex, and they are interested in enjoying sex as much as he is. In some cases, they initiate, and he isn't always ready to move at her pace. Men don't have the luxury of being able to fake interest or just bear it until it's over. If he isn't feeling sexy, then intercourse is probably not going to happen. So it's no longer a man's world, and men today have to move strategically to navigate these sexual complexities that their grandfather never had to deal with. Men are trying to come across as masculine, but not toxic, confident, but not misogynistic. He wants to get laid, but he also has to appear like he has interest in romance. If women are the object of his desire, he isn't just competing with other men, he's also competing with women. It's a lot of pressure. Surprisingly, many men dealing with ED are in their 20s and 30s, and that's a time in life when men are not expected to have ED. There's nothing medically wrong with them, but psychologically they're dealing with intense anxiety that impairs their ability to relax and enjoy sex. When the brain perceives a threat, physically or conceptually, its primary goal is survival. The brain doesn't know the difference between your fear of a bear chasing you through the woods or your fear of getting dumped. It just knows that you're in distress and it wants to do everything possible to help you survive. When the anxiety begins, blood starts pumping very quickly through the veins to muscles and vital organs to prepare the body for fight or flight. And while you guys might think that your penis is a vital organ, the blood is actually not pumping there in a way that's necessary to help you get and keep an erection. Women frequently don't understand how men get and stay erect. They've been led to believe that men are always ready for sex, anytime, anywhere, and if she wants it and he can't deliver, she might feel rejected, she might question if he finds her attractive, or if he's cheating on her with someone else. Men have shared stories in therapy of women crying, yelling, calling them names, even throwing things at them when they can't get an erection. I've also heard men talk about their girlfriend's tirades on social media, exposing his ED and publicly questioning his manhood. That's emotional abuse. It isn't sexy, and it's not going to make the situation better. Psychologically, men have to feel emotionally safe to enjoy sexual intercourse. He needs to feel confident and relaxed. He needs to feel ready. He needs to trust her and know that she respects him. And of course, she needs to feel safe and ready too. But since she doesn't need an erection to participate in intercourse, this is less about her and mostly about him. Men underestimate the need for emotional readiness. They experience themselves privately waking up with erections, getting erections when they think about sex, when they're looking at pornography, or when they're masturbating. So they sometimes ask, how can it work in all those other times, but then it doesn't work with her? In the context of being alone, there's no judgment of your performance. It's all about you at your own pace and the way you like it. There are no expectations, there are no demands, and there are no threats that will raise your anxiety. The penis is an organ of the body, and unlike a dildo or a sex toy, the penis is influenced by many variables internally and externally. A lack of rest, too much alcohol or other recreational substance, medications like decongestants or antidepressants, obesity, fear of a disease or unwanted pregnancy. These are all examples of internal factors that can affect the quality of an erection and how long it lasts. Externally, men can be influenced by things like noise, temperature of the room, potential for threat such as children or family walking in, or even repulsive odors like cologne or body odor. Men and women need to understand the facts about erections and stop believing the myths. So far, I've talked a lot about straight men, but what about gay men or bi men? Don't they experience ED too? Well, of course they do, but they tend to be less limited by it than straight men. Gay men enjoy more sexual variety than straight men. They don't have the same role expectations as straight men and women. If one man can't get erect enough to penetrate, then he will bottom and enjoy it as much or maybe even more. Gay men understand ED because they can relate to having a penis that doesn't always behave the way you want it to. They give each other some slack that straight men don't always get from women. So, what should a man do if he's experiencing ED? First, identify the source. If the ED is medically related, you're likely going to experience it consistently, including when you are alone and masturbating. It is always a good idea to consult your physician just to rule out any medical concerns. If you can get an erection when you are alone, but not with a partner, then it might be psychological. A sex therapist can assist you with overcoming psychological barriers that stand in your way of pleasure. If you can get erect with 4 out of 5 partners, but not the 5th one, then it might be relational. It's reasonable that you don't want to have sex with everyone, regardless how physically attractive they are. If you don't like them or trust them, you're not going to find them sexy, and your body is not going to respond. If you can get an erection when you're sober, but not when you're drunk, or when you're rested, but not when you're tired, it's likely contextual. That means the ED happens in specific circumstances, and when those specific variables are removed, the ED is no longer an issue. Identifying the source of the ED is important to determine how to resolve it. Pills don't fix everything. ED pills have never been marketed as an anti-anxiety medication. They will not stop your girlfriend from calling you names, and they don't make someone with an ugly personality suddenly seem attractive. Secondly, solicit your partner's cooperation in the plan of treatment. Ask her or him for what you need so the two of you can have the best possible experience. If he or she is not willing to assist, then it might be time to end that relationship and move on. Sometimes partners or spouses refuse to come to sex therapy. They say things like, well, it's your problem, so you deal with it. That disrespect and lack of compassion is likely one of the factors that contributes to the ED. We don't expect women to stay in relationships with men who are disrespectful or emotionally abusive. We shouldn't expect that of men either. The worst thing you can do is stop initiating sex or pull away from your partner when ED occurs. Find a way to stay erotically engaged. Cuddle, kiss, pleasure your partner with your hands, your mouth, a toy. This is actually another way that many gay men differ from straight men. Straight men often think that if their penis isn't in a vagina, then they aren't having sex. Gay men understand that there are lots of ways that they can have erotic pleasure with a partner because they're not bound by those rigid roles pertaining to gender and sexual orientation. Whatever it is, do something to continue to hold space for sex. This alone is sometimes sufficient to restore relaxation and raise the erotic energy. Lastly, relax. Have fun. Don't take this too seriously. Erections are not an intellectual process. Overthinking sex can lead to many sexual dysfunctions other than ED. A consultation with a qualified sex therapist can help you determine the source of the problem and the best resolution. There are multiple options to treating ED. You should know all of them and have a clear understanding about which one is right for you. So, I hope this video has been helpful. Please subscribe, hit the like button. I would love it if you picked up a copy of my book, Sexual Integrity, Finding the Courage to Be Yourself. And I would love to hear from you. You can reach out to me through my website at sexualintegritycoach.com.